thank you to the committee for letting me speak today as well. So as we said, my name's Nicola, I'm from Glasgow, which is in Scotland, and if you don't know, that's the northern part of the UK. My presentation today is on the effects of postpartum pain relief on the behaviour of calves born to both assisted and unassisted parturition. So firstly, to put it into some context, it is estimated that in the UK and Ireland, up to 50% of parturition events in cattle might be assisted. And if it was as high as 50%, that in dairy cattle is about 1 million calves almost every year. And we do know that most of that assistance is farmer assistance, in the UK at least. Now, assistance is not necessarily synonymous with dystocia, and not all animals receiving assistance necessarily truly need it. However, we do know that assistance itself is associated with an increased risk in mortality, and there's some evidence to suggest that heifer calves born to assistance do have a reduced productivity later in life. There is evidence of non-steroidal use by practitioners in calves that they deliver to assisted calving. When I started this study, the benefit of that was completely unknown. Hold on a moment. This is the wrong presentation. The newer one is not a video. This is the wrong one. So I uploaded a newer presentation yesterday with a video, and this is the wrong one. Sorry, I've got a newer version of the presentation, which will come in a minute. No, it's still the wrong one. Same one. Yeah. That's the one. Yeah, thank you. Sorry for the delay. Thank you for not disappearing for coffee. So, as I was saying, when I started this project, the evidence base for the use of analgesia in newborn calves was completely unknown. There was no evidence at all. Some of our colleagues from Canada did present work yesterday, and the evidence base is now growing, but it's still quite small, and I think the evidence is still a little bit uncertain. So bearing this in mind, we designed a study to investigate the use of non-steroidal anti-inflammatory drug in newborn calves, born to farmer-assisted calving. And our hypothesis was that being born to assistance is probably painful for calves, possibly even just being born in general it causes some pain. And as such, provision of analgesia will ameliorate that pain and improve the welfare of these calves. So in order to do this, we designed a 2-by-2 randomized control trial. We'd done some power calculations prior to the study starting and determined that we needed about 80 calves, so 40 assisted calves and 40 unassisted calves. So that was what we aimed to recruit, and assisted calves were recruited as and when they occurred. And then the first unassisted calf born that was eligible after the assisted calf was recruited was also recruited as a time-matched control. Animals were randomly allocated to receive either a ketoprofen treatment or a placebo treatment that was given within 3 hours of calving. And we monitored the behavior for 48 hours, and this allowed us to, firstly, to analyze any potential differences that might be related to conditions, for example, more delayed onset pain maybe, that we weren't sure if that happens, but also it allowed us to see if maybe any potential differences that we did find lasted sort of as long as the expected duration or even longer than the expected duration of ketoprofen, which in calves is up to 24 hours. So we did, as you can see in this table there, we did recruit 80 calves. We actually recruited more than 80 calves, but at the data analysis stage, we had to remove 5 calves from analysis. So we ended up with not quite the 80 that we wanted. It was 75 in total. So the decision whether to assist or not was made by the farmer. And the degree of assistance was scored in accordance with this scoring table that's up there. So 1 was unassisted, scores 2 and 3 were both types of farmer assistance, and for the purposes of data analysis, we grouped that together into one assisted group. So when I refer to, from now on, to assistance, that's scores 2 and 3 grouped together. Score 4, which is veterinary assistance, we did not include those in the study. And that was mainly because, as I mentioned earlier, in the UK and Ireland, most assistance is provided by farmers. So we were particularly interested in farmer-assisted calves for this study. So we performed this study on a commercial dairy farm and not a research unit. And it's a farm that we go to quite regularly at Glasgow University. They milk about 700 cows. And they are housed all year round, which was helpful for us because the management is quite uniform. It's sort of as uniform as you maybe would hope for a commercial farm. And that allowed us to hopefully minimize any confounding management factors that there might potentially be. Crucially, however, they calve about 60 cows every month, and they estimated they had between 10 and 15% were assisted, so that meant that we had enough animals, we thought we would have enough animals to be able to recruit the number that we needed in the time period that we had available to us. So in order to collect the behavioural data, we set up, similar to in the previous talk actually, we set up CCTV cameras. The calves are in group pens of between 4 and 6 calves that you can see in the picture on the left. There's 1 camera per pen. The video, because obviously you didn't know when an animal was going to calve, so the video was just recording constantly, and I downloaded the relevant 48 hours and filed it for storage. And the data was collected in a single period between March and December 2016, so it took us 10 months to gather this data. So the observations, we also used instantaneous sampling, and it's called scan sampling as well by some authors. And when I did this, I was the observer. And at the time, I was blind to both the assistance and the treatment status, and I did the video analysis back in the office in Glasgow, which is an hour away from the farm. We'd done some pilot work, a student did some pilot work for us and had determined that a sampling interval of every 5 minutes, every other hour for the 48-hour period was sufficient. I didn't use Observer, I did this all myself, and we had 288 time points, so 288 observations for every calf on this study. We recorded what we called primary behaviours and secondary behaviours. So what we called primary behaviours were behaviours that the calf had to be doing at any point in time, or at least the time points in which it was visible. And these behaviours were mutually exclusive. So they were lying behaviours, and if the calf was lying, we recorded the posture that the calf was lying in, or active or non-lying behaviours. And the non-lying behaviours for the calves, we had standing, walking, struggling to stand, which I actually originally called attempting to stand, but it sounded a bit too positive and confused everybody, and it's struggling to stand or play. Now, lying behaviours, as is consistent with the previous literature that was already out there, lying behaviour was by far and away the most common behaviour, and all calves in all groups spent at least 80% of their time lying, so quite a small proportion of the time budget was available for doing anything else. We also recorded secondary behaviours, and these behaviours were behaviours that the calves could be doing at the same time as primary behaviours, but they didn't have to be doing them, so they were not in every single time point. And these were behaviours like feeding, social behaviours, and grooming behaviours. So we've got a video here, which is what caused the problem to start off with, so I hope you like it. If we look at the calf in the middle at the top of this video on the left here, and just watch this, this is a very good example of play behaviour. It starts standing, and now it starts skipping around and jumping, and that's a really good example of play behaviour, it's a primary behaviour. The other three calves in that group are showing lying behaviours, and none of them are showing secondary behaviours. If we look at the picture on the right there, and you look at the calf standing in the middle, that's standing, which is a primary behaviour, but it's also grooming the calf to its left, so that's a secondary behaviour. So we look at some results. To start off with, if we look at play behaviour, play is very interesting behaviour, at least to me anyway, because play is sort of pretty much uniformly shown amongst young mammals. We know that almost all young mammals and even some non-mammals show play behaviour, but its function is actually not that well understood. What we do know, however, is it appears to show no sort of immediate survival purpose. And it's considered to be quite a true luxury behaviour. So the calves or whatever neonate shows play behaviour, they're doing so because they choose to do so. And it's considered, therefore, to be quite a good indicator of a positive welfare state. And I think if you think back to the calf that was playing at the risk of being a bit anthropomorphic, I think you can appreciate that calf does look like it's quite happy and enjoying its life. And we discovered that if you group the calves together, so irrespective of whether they received treatment or placebo, the calves born to assistance showed less play behaviour than the calves that were born to no assistance. And this would suggest that assistance does adversely affect the welfare of these calves. We also found that, again, if you group them, so this is irrespective of assistance status, you can see that calves provided with ketoprofen, whether they were born to assistance or not, they engaged in more play behaviour than the calves that were administered placebo. And this is suggestive that pain is probably affecting the welfare of these calves, whether they were born to assistance or not, and that is ameliorated by the provision of a non-steroidal anti-inflammatory drug. Interestingly, we saw these two differences for behaviour but no interaction effect, but we think that might be because it was quite a relatively small study. Another result we found that was quite interesting was lateral recumbency. So lateral recumbency is generally considered to be a fairly abnormal lying position to calves, and it is thought that calves who are feeling sick or in pain maybe will choose to lie in lateral recumbency preferentially over other lying positions, primarily sternal recumbency. We saw an interaction effect here, and you can see from the graph there that calves in the unassisted treatment group, so the unassisted ketoprofen group, they spent a lot less time in lateral recumbency than the calves in any of the other groups. And that's quite interesting because it would suggest that the calves in the unassisted group are in pain, and possibly the analgesia actually is more beneficial to these calves than the assisted calves, which is what we expected at the beginning of the study. What's also interesting here is if you look at the yellow bar on the far right, you can see that the calves in the unassisted placebo group spend as much time lying in lateral recumbency as the calves in both assisted groups, which again suggests that being born is possibly painful for these calves, even if they're not born to assistance. The calves in the assisted ketoprofen group did spend numerically less time in lateral recumbency than both the placebo groups, but it was not statistically significant. So if you think back to this graph here, I think it's possible that this sort of looks like maybe calves that are born to no assistance benefit more than calves that are born to assistance, but I think it's possible also that calves born to assistance may have more challenges than calves over and above pain than calves that are born to no assistance, and that might be reducing the apparent effect and making the effect of pain relief a bit less obvious. So in conclusion, I think although this still is a relatively small study, and it's certainly not without its limitations, we have seen some behavioural differences that do suggest that being born is painful for these calves. It suggests that calves born to a normal, unassisted calving experience similar degrees of pain to calves born to a mild to moderate degree of farmer-assisted calving. Behaviour was affected by both assistance status and non-steroidal treatment. And some behaviours, but not all of them, showed an interaction effect. I feel that there are probably other factors. I think pain is definitely a factor for these calves, and I think there are definitely other parturition related factors as well that kind of maybe muddy the water a little bit, and I think particularly calves born to assistance. For example, calves born to assistance have been shown to have an increased risk of acidosis. I think although this work would suggest that maybe the unassisted calves benefit more from the analgesia, I think that that's not to say that assisted calves do not benefit, and it is possible that calves born to assistance that maybe experience greater challenges, we don't 100% know yet, it is possible that giving those animals pain relief maybe helps them to recover from the challenges experienced during a prolonged and assisted calving, because you're ameliorating at least one of their problems. We just don't know, and I think further research is probably needed there to see if analgesia does aid the recovery of some of these calves. So I'd just like to thank my supervisors, Catherine Ellis, Dorothy McKeegan, and Lorenzo Viora, and also Jessica Martin, who provided a lot of assistance with the statistical analysis for this study. I'd like to thank the students that helped with the pilot work, Marielle, who provided some funding in the product, also other funders, the James Herriot Fund, the James Houston Crawford Endowment Fund, and of course the farmers, because they just couldn't have done the project without them. So thank you very much, and if anybody has any questions.
Okay, thank you very much.